Failure is not a word that we like to hear. It's a pretty dire moment to have your life's work be deemed a failure. To hear systems failure during a space expedition, or learn the source of your chest pain is congestive heart failure.
So the word congestive heart failure implies something's wrong with the pump. Most commonly, the heart isn't beating as vigorously as it used to.
In some cases, the heart can't fill with enough blood. In others, the heart can't pump the blood with enough force. Some hearts have trouble doing both. Congestive heart failure can affect either the right side or the left, though in most cases, it affects both sides. Heart failure is partially classified with a measurement of how well your heart is pumping.
We use the word in cardiology, ejection fraction. When the heart beats, it doesn't go from full to empty. It goes from full to maybe half empty. So if you have, let's say, 100 cc's of blood when the heart's relaxed, and it squeezes in half to 50, that fraction is 50%. And so that's the word the cardiologists use to try to understand the strength of the heart muscle, ejection fraction. And above 50 or 55 is typically a normal number, but if you've had multiple heart attacks, that ejection fraction can drop to 40 or 30 or less.
If the blood is not pumping through the body, well, it has to go somewhere, right? Sometimes it backs up or congests in other locations.
Congestion means now the blood is passively going behind the heart. Well, what does that mean? It means it's going to the lungs. So somebody may start becoming short of breath. That short of breath, gravity, when lying in bed, may cause the fluid to build up in the lungs, particularly at night, and you might find yourself sitting up on 3 or 4 pillows to breathe more comfortably. You might find yourself sitting up in the middle of the night to catch your breath. Once blood goes past the lungs, it may start going into the belly, where there can be bloating or swelling in the legs as the blood passively congests behind the heart.
Estimates suggest that 3 million Americans are affected by congestive heart failure. Heart failure often develops after other cardiac conditions have damaged the heart. It's considered the final common stage of many cardiac diseases.
Congestive heart failure most commonly is associated with coronary artery disease and heart attacks. Sometimes the word congestive heart failure can occur immediately with a heart attack. So somebody who's having an hour of crushing chest pain and starts getting short of breath can be developing congestive heart failure because the heart's being damaged right then and there. And so there is a common association of the two, although they're two distinct issues.
In addition to congested lungs and fluid retention, congestive heart failure can cause fatigue, dizziness, weakness, and rapid or irregular heartbeats. Your doctor will use these symptoms as well as a medical history and a physical exam to diagnose congestive heart failure.
If somebody's sick right this moment with congestive heart failure, the word congestion, fluid building up behind the heart into the lungs, we want to treat the congestion right then and there. And so water pills, diuretics, they're the most immediate treatment when you're short of breath.
Once the immediate danger is addressed, determining the cause and the type of congestive heart failure will influence treatment going forward. This is a chronic disease that needs lifelong management. However, there has been a revolution in medications that can stabilize and even improve the condition, allowing patients to live longer and better.
A special kind of defibrillators that can electrically make the heart beat more efficiently so that we can actually mechanically implant like a pacemaker device with wires into the heart to make the heart beat more efficiently and to treat preventatively any dangerous irregular heartbeats that sometimes occur with congestive heart failure, because the word congestive heart failure does imply a potential danger. So we have medications that can help get rid of extra water. We can have water pills that have been around for a long time. We have medications that can help make the heart beat more easily, more efficiently. We have medications called beta blockers that relax the heart and over time can actually help the heart beat a little more efficiently and improve the ejection fraction, the strength of the heart muscle, and this has all been relatively recent years that these medications have been commonly used by the cardiologist, and that there's no question at all that we've improved prognosis from the combination of the modern medications, and in a more severe case, when the ejection fraction is lower, implanting these devices called defibrillators.
Once your condition is stabilized and your doctor gives you the green light, some lifestyle changes can dramatically improve your quality of life. Engaging in modest exercise, eating a healthier diet, reducing salt intake, managing stress, and losing weight can improve prognosis. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.